How do genetics affect asthma versus COPD risk? Imagine your lungs as a complex system shaped by both your genes and your environment. Understanding how genetics influence asthma and chronic obstructive pulmonary disease can help you see why some people develop these conditions while others don't. Genetics play a big role in asthma risk. If one parent has asthma, a child's chance of developing it is about 25%. If both parents have asthma, that risk jumps to around 50%. Studies of identical twins show that if one twin has asthma, the other has about a 75% chance of having it too. This suggests a strong genetic component combined with environmental factors. Many genes linked to asthma are also connected to other allergic conditions like eczema and hay fever. This shared genetic tendency is called atopy, which means being highly sensitive to allergens. Different gene patterns are involved in allergic asthma, which is the most common type, compared to non-allergic asthma. Researchers have identified specific genes related to immune response and inflammation, but how these genes interact with each other and with environmental triggers is still being studied. In contrast, chronic obstructive pulmonary disease risk is mainly driven by environmental exposures. Smoking cigarettes over many years is the biggest factor. While genetics can influence susceptibility, they are less directly involved in causing the disease. Rare genetic mutations, like alpha-1 antitrypsin deficiency, can increase the risk, but these are uncommon. Most cases of chronic obstructive pulmonary disease happen because of long-term exposure to irritants like cigarette smoke, air pollution, or workplace fumes that damage the lungs. For asthma, family history is a strong indicator of risk. Knowing your genetic background can help in early detection and management. If you have a family history of asthma or allergies, paying attention to environmental triggers can make a difference. Managing asthma often involves controlling both inherited sensitivities and environmental factors. On the other hand, chronic obstructive pulmonary disease is more about lifestyle choices and environmental exposures. While genetics can influence how vulnerable you are, avoiding smoking and other lung irritants is key to prevention. So, in simple terms, genetics have a clear and strong influence on asthma risk, especially related to immune response and allergies. For chronic obstructive pulmonary disease, your environment and habits play a bigger role, with genetics having a smaller part. Knowing this helps you understand why some people develop these lung conditions and how you might reduce your own risk.